Welcome back to Mayo Clinic Radio. I'm Dr. Tom Shives.
And I'm Tracy McCrae.
The holidays are often referred to as the most wonderful time of the year.
Why didn't you sing that?
That is a song, isn't it?
Yes, it is.
But the holidays can be stressful. We all have obligations and demands on our time. You know, parties and shopping and baking and cleaning and entertaining, to name just a few.
And trying to find the perfect gift for you. It's so hard to do. Luckily, there
Gift certificates are okay.
Okay, there are some ways, even some practical tips to help us deal with the stress and ward off the sadness and depression that can sometimes accompany the season. And here to help us handle the stress of the holidays are Mayo Clinic experts, Susanne Cutshall, nurse practitioner, an integrative health specialist, and Debbie Fuehrer, a mind-body medicine counselor. Welcome to the program, both of you. It's great to have you here.
Thank you.
Thank you.
Yeah, great to have you both. Now, but before we talk about what we're supposed to talk about, I want you to explain to our listeners and to me what your titles mean. Nurse practitioner, I understand, but an integrative health specialist. Susan, you start. What does that mean?
Yeah, that's me. So actually, I'm a clinical nurse specialist. So that means I'm an advanced practice nurse, and I have a specialty training in integrative medicine.
And integrative medicine means?
It's things like, used to be the thought of alternative medicine, and then moving to more complementary. Now I think of it as integrative medicine. So things like massage, acupuncture, stress management counseling, herbs and supplements is what we call integrative medicine practice. So things that are not always considered part of conventional care, but we consider those things that we can integrate into the medical practice to help people manage symptoms and overall work with improving their health.
So you integrate the alternative with the traditional,
Correct.
basically.
Correct.
All right, and Debbie Fuehrer, you are a mind-body medicine counselor. Now tell us what that means.
I believe that every single thought we have, there's a chemical reaction. There's a response in the body. And so we start with, hey, what are you thinking? Are you thinking things that are negative and maybe at best neutral? Gosh, you know what? There's another way to live. And so we explore ways to add more meaningful thoughts, more things of novelty, of curiosity. And I actually had a doctor from the Alzheimer's unit shadow me, and he said, Deb, everything that you're teaching your patients is the exact same thing that we're teaching ours.
Yeah, well, that's very interesting. So what goes on in your mind has an effect on your body.
Definitely.
If you have depression, I can see how the holidays with all of the additional stress can really get you down. But there's some people who actually just have depression during the holidays because of all the stress and all of the activity. Is that something that you notice when you're treating patients?
We do. It's kind of like you were talking about. We have expectations for the holidays. You know, we're busy otherwise, and then we add on, and we have to do shopping, we have to wrap presents, we have to do cards, and all those expectations. So people put a lot of expectations on themselves, and sometimes that can lead to anxiety or feeling a little bit of sad as well too. Or they're kind of lacking kind of the meaning in the holiday. So what is that meaning? Or kind of seeking some connection. So how do they connect with other people in meaningful ways during the holidays?
So that's one of the warning signs, connecting with people. What are other warning signs?
They may overeat during the holidays. They
Isn't
may
that part
try
of
to
the
do
holidays?
That's a warning sign?
That's what you do.
It's a balance in there, right?
It's balance, overindulge in alcohol, in the things that are self-soothing for them. And we're saying, hey, you know what? You could really enjoy what you are eating, but do it in a more mindful way. And then the whole point of the season, what is the meaning behind all of this? And the more that we can delve into that, then it can help reduce their anxiety and help them connect more with people in a way that they will really enjoy, instead of what is presented as the ultimate holiday, which is everyone's always laughing and having the best time ever at the holidays, and how come I'm not? Mm-hmm. And we go, hey, that's a reality expectation mismatch.
Yeah, interesting. So people actually patients who come to see you, people who come to see you, referred from someone else, and do you see an increase in the number of referrals around the holidays?
They are referred to come and see us. So by their primaries or other advanced practice folks will consult them to see us. I mean, we have a lot of consults to begin with because life can be busy and stressful in just the way it is. But over the holidays, sometimes we'll see a little bit more of that as well, yes. So we get a chance to talk about that specifically when we see folks in a consult. So how do we take what we tell you ordinarily and then apply that specifically during a holiday session when it's a little bit more challenging as well?
Well, and it's also the darkest time of the year, shortest daylight, so you've got winter blues on top of maybe holiday stress.
Yeah, there's been days where we haven't seen the sun for a long time. I think we're probably all feeling that a little bit right now as well, too. So how do we help people find ways to connect with light in a different way? Debbie was talking about this earlier, so light boxes, or even can we encourage people to go outside for even 20 minutes or even less than that, just so they can get a little bit of nature for that to help with their winter blues as well, too. So it's finding what are those unique things we can help people with even when the weather gets to be a challenge as well.
So let's talk about, I'm sorry, go ahead.
What might I say to my physician that would prompt a referral to someone like you, Susan? Or Debbie, either one?
Yeah, I think
I mean, because you're kind of an alternative medicine sort of person, but I assume most of your referrals are from internal medicine, family practice. How do what prompts them to send a patient to you?
Yeah, it probably is if they may express that they're feeling a little anxious. They may be expressing that they're feeling a little sad over the holidays. They also may be expressing that they've lost interest in things that they ordinarily would have interest in, or feeling like they're down. They have the blues as well. Or they could mention that they just don't feel connected. What their meaning in life has been, they're not sure what that is. That might prompt a consult for us, or at least for Debbie and I, for a stress management consult. They also might just mention that they have a lot of stress with their job or other things going on in their life. And again, that would be something that we talk to people about. As far as integrated medicine, it might be an interest also in things like massage or acupuncture or other things that maybe they have pain or something, and what they're doing isn't managing, and they're looking at other ways that they have self things that they can do to help manage their symptoms too.
I just have a quick follow-up question. So why would the physician send the patient to you as opposed to, let's say, a psychologist or a psychiatrist if they complain about sadness and depression?
I specialize in stress management consults.
Well,
and
you
so
must be. You're really busy.
So that's what I was going to say. We don't notice an increase because we always have an increase.
Okay.
And we always have a wait list. And it's just that now you have a different kinds of stress during the holidays, but it's layered on top of all the other kinds of stress. Overload at work, relationship problems, maybe they have health concerns. And now you're going to add on that they're supposed to be happy during this time of the year, and then they feel like, oh no, now there's some more pressure and some more stress. What am I doing wrong? And so then we can talk about what those expectations are and tap into their skill sets.
But why you instead of a psychologist?
And often I answer that too, is often it's a combination. So people might be seeing somebody in psychiatry or psychology and seeing us for some of the practical applications like mindfulness, other tools that they could use. So it's a nice combination when we work together, I think.
It's not unusual for me to work in conjunction with a psychiatrist here at the clinic.
Got it.
Each of you give me 3 practical tips to help holiday stress and depression.
Well, I can start, I guess. So I think my first one is kind of what we talked about earlier, lowering some of the expectations of the holidays and looking at what's most meaningful. So this is my tip for this year. I'm going to ask my daughters, who are teenagers, what is most meaningful to them in the holidays, and we'll make sure that we do those things as well. And looking at what we have control over and what's most meaningful, that's a nice box just to focus on. Some of the less stuff we can let go then. And again, some of the most happiest people are the people that do find meaning in the holidays. So what's most meaningful and how do we savor it? So those things we really love, how do we really pay attention to them and savor that and discuss it as a family? And then the other big thing is making connections. So in unexpected ways. Debbie and I were talking earlier about just ringing the bell and stuff can be a way to connect. So we not think about that, but just think about the people you get to talk to when you do that, because you're bringing joy and people ask questions and you get to connect. So finding interesting ways to make connections.
Debbie, what are your 3?
Curiosity. Every day I do a walkabout. And I try to go out in the world, and one of my favorite things I do with my husband is we go on a treasure hunt. And every day we promise we're going to bring home a treasure to each other. And that's usually a funny story or a kind story or something new we've learned or something beautiful in nature. And then we share that for at least 2 minutes. And that counteracts that the typical American family spends about 90 seconds a day talking to each other now.
Wow.
You know, hey,
Incredible.
did you pick up the dry cleaning? Kids, get your homework done.
What'd you have for lunch?
Yes, that's not that's not in a meaningful way, right?
Do you have another one?
You got time for 2 more.
Oh man, I've got 17 more. Okay, so I also like thinking that every day I'm writing the story of my life. And I want this day to be remembered in some kind of way that's going to be meaningful for me, but then maybe through that I make a connection with someone. So like just today, for example, I did my walkabout, and what I do is I send silent well wishes to the people I walk by. Don't say them out loud, because that could maybe look a little creepy. But if I'm just thinking them as I walk past, I hope that person has more healing take place. I hope that person laughs hard. I hope they have the connections they need. Then lo and behold, almost invariably, because I'll have my badge on, I will have people come up and ask me all kinds of questions. And today, just walking over here, I had someone from another country come up in sort of broken English and asked if he could have his picture taken with me. And so
Out of the blue?
out of the blue.
Happens to her all the
That
time.
happens all the time.
We better take a photo when this is over. Huh? You get in line.
Yeah.
Well, those are terrific.
I think those key principles probably for both of us of what we said is really being in that spirit of gratitude and compassion over the holiday season.
All right. We've been talking about how to handle stress during the holidays and beat the winter blues with Susanne Cutshall, a nurse practitioner and integrative medicine specialist, and Debbie Fuehrer, a mind-body medicine counselor right here at Mayo Clinic. Thanks for joining us.
Thank you.
Thank you.